All right, welcome back, Mighty Family, to another Dr. Eric Debunks. So today will be part 2 of our multi-part series on vitamins and supplements. I hope you found part 1 to be, a good and simple overview on water-soluble vitamins. So for those that missed it, feel free to check it out on YouTube or inside our Mighty Health app. So as for today, we'll really be finishing up vitamins by reviewing the remainder that are fat soluble. It's important to make this distinction because fat soluble vitamins are not as easily cleared in our bodies, and it hangs around in our fat tissues, so it can accumulate to toxic levels if not careful with how we're taking. So an easy way for me to remember the fat soluble vitamins is the acronym KD. So vitamin K, A, D, and E. Let's jump in and see what they do. So vitamin K, really its main use is to maintain our ability to prevent bleeding, but it also plays a role in bone mineralization. It's commonly promoted for bone health on social media, but really there's been no such clinical proven benefit. It's primarily produced by our gut bacteria, so to be deficient of it, it's quite rare. So high doses are generally non-toxic, but it can affect medications such as warfarin, which is a common blood thinner medication to treat a variety of medical conditions. So in terms of food sources, vitamin K can be found in avocados, kale, eggs, just to name a few. Okay, so next is vitamin A. This vitamin is required to maintain the integrity of the lining of our blood vessels, our organs, our skin, as well as even maintaining eye health. It also has antioxidant properties and plays a large role in the development of organs during pregnancy. Despite its importance in the body, there are really no indications for supplementation here. In fact, this vitamin in particular is concerning when consumed at high levels and can cause increased pressure in our brains, inflammation of our skin, nausea, vomiting, blurry vision, and even convulsions. So in addition, chronic use in the form of medication to treat acne can cause birth defects. Therefore, contraception is needed for at least a year after the use of this drug. And other concerns as well is that vitamin A supplementation may be linked with increased instances of lung cancer. So it's quite abundant in a bunch of foods such as carrots, tomatoes, and red bell peppers. All right, so vitamin D, really the main role increasing intestinal absorption of calcium, phosphate, magnesium. Through sun exposure, we get adequate vitamin D, but it's obviously dependent on where you live or what your lifestyle is. Deficiency leads to impaired bone mineralization and bone damage. Too much vitamin D, however, is really quite rare, but it can lead to excess calcium of the body, which can cause damage to our soft tissues and organs. Food sources of vitamin D include dairy, salmon, eggs. And lastly is vitamin E. It is the most natural, abundant antioxidant. Really overt clinical deficiency, never been described in normal individuals, even on a low diet of this vitamin. So vitamin E also has blood thinning effects and has been shown to cause increased risk of bleeding events in patients receiving warfarin, which is a common blood thinning medication. At present, large review studies show that there is a dose-related increase in mortality, and as such, vitamin E supplementation should be avoided. Okay, Mighty Family, I know that was just a ton of information regarding fat-soluble vitamins. For those that haven't fallen asleep on me this morning just yet, let me see if I can break it down into a few mighty take-home messages. So 1, it's important to remember that fat-soluble vitamins can accumulate in our bodies compared to water-soluble vitamins. As a result, there's a concern for toxicity with these vitamins and excess supplementation. Number 2, vitamin D. It's a hot topic, so I'll try to summarize with this. There is no indication for supplementation unless you have a clinical deficiency that is determined by blood work. Previous studies may have shown that it can potentially reduce the risk of falls, but follow-up systemic studies really show there's no difference in those that take supplements and those that do not. In addition, large research studies have shown that there is no added benefit when compared to placebo for reducing bone fracture risk. However, if you're experiencing a known diagnosis of osteoporosis, this is a situation where vitamin D and calcium supplementation may be warranted and worth a discussion with your primary care provider. And then number 3, so created in 1984, the U.S. Preventative Services Task Force is an independent volunteer panel of national experts in prevention and evidence-based medicine. Primary care doctors, like myself, tend to follow these guidelines to make preventative medicine recommendations. And based on these recommendations, there's not enough information to suggest there is a benefit to warrant vitamin and mineral supplementation to the general population. So really my last message to you all is this: everyone is different. I know many members have found supplements that work for them, and my goal is to never tell you that I know your body's better than you do. My goal as a doctor is just to make sure everything you're putting into your body is safe. So for those that are currently not taking supplementations, the goal of this talk is to hopefully take some pressure off of you and feeling like you're missing out on some magical pill. The magical pill is in our healthy whole foods, and that message will always be true. All right, so I hope this part 2 series of vitamins and supplementation has been insightful. I just wanted to wrap up the whole vitamins part of things, but stay tuned for the next part of this series where we'll dive into things a little more specific, like your Instaflex, your turmeric, your omega-3s, just to name a few. And as always, I look forward to connecting with you all again soon. For those that are not a part of the Mighty family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern holistic home for healthy aging.